Every year, millions of people all over the world get norovirus. It can be contracted at any time of the year and can spread very easily from person to person. So what is norovirus? Well, it's more commonly known as the stomach bug or stomach flu. It can lead to gastroenteritis and can present symptoms such as diarrhea, nausea, and even fever. For most adults, it typically passes within a few days, but in children, it can get worse, and it's important to keep an eye on them. Dr. Gotti Corpus, pediatrician at Baylor Scott & White Health in Cedar Park, Texas, spoke with us for more information about norovirus.
It spiked about a decade ago when we started giving rotavirus vaccine. Rotavirus used to be the #1 cause of vomiting and diarrhea in children and dehydration. And because we were vaccinating against it and we've developed it, it's kind of gone off and norovirus took over. And unfortunately, there's no vaccine for norovirus yet. Norovirus, enterovirus, adenovirus, and other even rotavirus, it can cause inflammation in your gut. And so what happens is when you have that inflammation, you're not able to absorb fluids well. And so when you drink or eat, it just passes in and out.
Symptoms of norovirus include nausea, vomiting, abdominal pain or cramps, diarrhea, low-grade fever, and muscle pain. According to the Mayo Clinic, there's no specific treatment for norovirus infection, and recovery generally depends on the health of your immune system. For most healthy adults, symptoms typically last 2 to 3 days. For children, it's important to keep track of how many days symptoms last and if they're staying hydrated. Dr. Corpus let us know when to see your child's pediatrician.
Definitely, if kids are having fevers for more than 3 to 5 days, if they're showing signs of dehydration, the eyes are sunken, their lips are pretty dry, they haven't had a wet diaper, or they haven't gone to the bathroom in about 12 hours or so. Very decreased energy, lethargic. Unfortunately, with the virus, we had to let it run its own course. The main thing is fluid hydration. So drink plenty of fluids. I always tell my parents, you can give your kids Pedialyte or electrolyte solutions.
So how does the norovirus spread, and how do we prevent it?
Contaminated surfaces, contaminated food. One of the things of prevention is frequent hand washing. With soap and water, alcohol gels on some occasion is allowed. Preparation of food, make sure it wasn't done by someone who's sick. And so getting it from reputable sources, because sometimes they're contaminated. We always tell kids too not to touch surfaces and then putting their hands in their mouth without washing them first.
Stomach flu is never fun. It can happen any time of the year, anywhere in the world, and it spreads from person to person very easily. So it's important to keep surfaces, food, and laundry clean. If you have the norovirus, Dr. Corpus recommends keeping your kids and yourself at home. The only food product Dr. Corpus says to avoid is dairy products and spicy foods, because those foods can exacerbate diarrhea. When traveling, be sure to continue proper hand washing and maybe keep a travel-sized alcohol gel with you. If you plan to travel outside of the country, Dr. Corpus recommends drinking only out of bottled water and to make sure your food is prepared in sanitary conditions. As a reminder, there is currently no medication to fight off the norovirus. It just has to run its course. For Daily RX, I'm Gabe Garza.